So my name is Arthur Gillespie. I go by the name of Art. I am 58 years old now. Just made 58 this past June. I currently work with the University of Chicago Police Department as a captain, but I've been on disability coming up on 5 years now. And so my journey has prevented me from being able to work actively, but I'm still connected to the department, again, just via disability status. So the cancer journey in specifics started with my COVID diagnosis. And so in 2020, March of 2020 or so, that's when I became ill with COVID. So early on in the, before the pandemic really hit. There wasn't a lot of information out there about the COVID virus and so forth. So my dad and I got sick at the same time. He went to the hospital first. I stayed home for about a week trying to manage the symptoms myself. And once I realized that was, not gonna end well, I decided to call paramedics and went to the hospital. I had a 12-day stay in the hospital for COVID treatment. And while I was there, obviously they were taking a lot of x-rays of my chest and so forth. And it was discovered that there was a mass on my right lung. And so I was told specifically that once I was discharged for the COVID, I would need to follow up to get more details about that mass. And so that's what I did. Sometime after discharge, went and got the biopsy done, and it was confirmed to be cancer. And so that led to a chemotherapy treatment. Sometime, I want to say I was diagnosed in maybe July of 2020 and went right into chemotherapy treatment, and then surgery was scheduled for November of 2020. And that surgery resulted in 2/3 of my right lung being removed. Fortunately, it was diagnosed as stage 1 cancer. So the COVID ultimately, in a sense, wound up being a blessing in disguise. And eventually I got to the point where I was recovering, was discharged from the surgery on supplemental oxygen. And so going back home, starting my rehabilitation, my intent was to work to get better, to go back to work. And so that's how I proceeded. After a couple of months, when I was capable, started working out again, because I'm a kind of fitness buff, and started to exercise again on a regular basis, and noticed that my oxygen, need for oxygen was starting to increase, even as I was actively, trying to work out and work past that. And then there came a point when I realized that my efforts seemed to plateau. I took that information to a doctor, and they were able to kind of confirm in data that there were some issues, specifically fibrosis. The team of doctors that I was working with had been working with them for the better part of maybe 2.5 years. I thought it would be best to get a second opinion. I was referred specifically to a COVID specialist. She's the one that specifically referred me to the team in Northwestern. I knew that with my cancer history, I was an unlikely candidate because I was still within the window that most cancer patients have to go past, meaning that I was at the three-year mark, I believe, and typically I think they want to see you maybe have 5 years cancer-free before they even consider. And so that was one of the reasons why I never really considered it seriously.
The
surgery? The transplant, anything transplant related, right?
Yeah.
I never even thought to ask about that. But my paramedic physician thought that I would be a good candidate too, but he also recognized that, you're only 3 years out. So again, it was the COVID doctor that said, I think that you'll benefit there because they have a specific program for people like you. And so, she helped me understand that this was new, something new that Northwestern was doing. And so she set me up with a consultation, and the consultation went really well. They put things into a different perspective for me and helped me understand not only what I was dealing with, but what the possibilities were for me through their program. And so once we started the evaluation went really quick, surprisingly. And before I knew it, I was placed on the list and approved. I was enrolled in the in the program officially summer of 24, late spring or summer 24. I'm sorry, not 24,
Oh, yeah,
not 24, right, 20,
Okay.
right. Obviously, yeah, the year before. I was very reluctant initially to have the transplant surgery based on my cancer surgery, yeah, because that was such a major ordeal for me, and particularly the recovery recovery process. And so when I thought about having to experience anything like that again, I was really reluctant. My consultation specifically with the surgeon, Dr. Barad, I give him credit for this because he really got me to focus. My prognosis was 1 to 2 years, life expectancy. So that made it pretty clear I really didn't have a lot of options here. And so once that was determined and I made the decision to proceed forward, yeah, having the surgery, the first thing I noticed was how different I felt compared to my first surgery. I came out of the anesthesia and I recognized that I felt actually pretty good. Now I know a lot of that was medication, but I still, was still markedly different than my first experience. And those first couple of days, first couple of weeks, I was able to regain mobility a lot quicker than I had before. And, even the medical staff was kind of surprised and impressed with how quickly I was kind of, recovering at certain phases. And so, before I know it, I was being, the talk of discharge was coming up, and maybe a couple of weeks in, and so I was able to get home now. 6 weeks after the surgery, before they took the staples out, and I was given the heads up, but once the staples came out, I gained a whole new level of being able to breathe differently, and so what I felt 100 times better. And so I was able to kind of regain some independence with chores and things like that. And so that was a huge lift in my spirits. And I want to say it was shortly after that I wound up being able to disconnect from supplement oxygen altogether. The actual surgery date, maybe 2.5 months, maybe 2 to 3 months when I was completely off supplement oxygen. I think the main point with Dr. Barad, he was just direct with me. And I appreciated that, because not that anyone else, wasn't or, sugarcoated things, but he gave me the clarity of the immediacy of the situation that it required. And that's what I really appreciated the most. He was the first one that spoke to me about the issues of quality of life and longevity. And so I had not had that conversation with anyone prior to him. I felt that my quality of life was declining because I became more and more feeble as my need for oxygen increased, and I virtually practically wasn't able to do anything. Chores, simple things like dressing myself, showering, those things started to become really, really difficult. So knowing that and understanding that, I knew there was something going on, and not really getting those answers prior to that. I was just really appreciative of his directness, his clarity, and his focus on what the situation actually was. And again, when I was reluctant, he made me understand that, this is if you want a better quality of life, and if you want more time, this is really the best option. And he was able to speak to the actual program and what the pros and cons were, what the successes were, things from his perspective that gave me clarity as well. It gave me trust in who he was. And then I heard from everybody else on the medical staff of just his reputation, and that made me feel really lucky, to be there. I'm not sure, it's not, again, something that I was seeking. It wasn't on my radar, but for some reason, I was put on a path to be in that position. And so I'm just thankful that it happened. There was a belief that because of this surgery, my capabilities were at a certain point. And in theory, that may have been the case, but physically that wasn't the case. And so they kept wanting to decrease my oxygen level at certain points, to see how I would respond. And I was okay with that, but keeping it there and maybe trying to force my body to respond and react in a certain way, that I didn't particularly care for, because I could feel the adverse effect. I could feel as if my body was craving oxygen that oxygen that I wasn't getting. And so, trying to communicate that, to the staff, and there was obviously a disagreement, or, we weren't seeing eye to eye on that issue. But we managed to get it worked out. I met obviously with doctors from different disciplines, pulmonologist, obviously cancer, Dr. Che. Everyone has been phenomenal. Everyone has just gone out of their way to make me understand every aspect of what it was that their, focus entailed. And so it was a comprehensive process from head to toe. First experience I've ever had like that. And so each and every doctor in every discipline, I have nothing but huge respect and gratitude for, because they all presented themselves in a way that I could only hope for. They made me feel much better about the process before and after. It's just been a completely seamless, process, all the way through. And so I have zero complaints about anyone at that level. And again, just, it's hard to put into words how appreciative I am of everyone at that particular level. One of the first things that comes to mind is my capacity to be able to withstand a lot of, what word I want to use, not trauma, but just the stress of the situation. The fact that I was able to take on all of that stress and still kind of maintain my sense of optimism, my sense of purpose, my desire to see this to a successful end. The fact that I was able to maintain that disposition, I'm very proud of that fact. Not sure where I got it from. I'm a spiritual person, not a very religious person, but what it made me recognize is that I'm obviously here for a reason. My experience has taught me that what you guys do is, it's a gift that's beyond words. Not everybody has the abilities to learn what you need to learn in order to be effective in this field. Just the academic, part of it, but then being able to apply that to real life. And when you're dealing with people from all walks of life, all backgrounds, to be able to have an impact on their physical well-being, and that in turn, have it impact their mental well-being, you're doing God's work. You know what I mean? You're doing work that not a lot of people can speak to, and it's something that's really, really, really special. And so, anyone that's going through the training for that type of occupation, I would say, when you have those tough days, when you're feeling overwhelmed and frustrated, please remember that people like me are so appreciative of the time that you put in, because when it matters, having that expertise, it makes all the difference. And you know, the fact that you go through this rigorous process of learning the things that are necessary in order to be effective at the job, there's an end point where it's going to pay off, you know, and I'm a walking testimony to that. Well, let's start with this. As you start the process of what would begin with a diagnosis, that is a time when you have to know that you have to remain strong. It's hard. It's easier said than done, particularly with cancer. Cancer is one of those diagnoses that hits people a lot of different ways. Most of us have had either family members. I've had a lot of family members that passed away from cancer. And so you never know what you're going to get. You never know what to expect. But I can say with all certainty from my own personal experience that your attitude and how you start that process with regards to your optimism, your outlook, your positivity is the first important, crucial step towards a successful outcome. If you feel defeated in the immediacy of all of that, that doesn't help your cause. And so maintaining some sense of optimism, even when it doesn't appear possible, is the best first step. Also, I would say, even when you get information passed on to you with regards to your circumstances, always seek a second opinion. Seek a second opinion if you don't feel comfortable with what you're hearing the first time, if you have questions that you don't believe are getting answered. It was only through seeking a second opinion. It's not to say that I didn't have trust in what I was getting, but if you have any inkling that there may be something else there that just isn't being addressed, it doesn't hurt to be an advocate for your own cause. And that's something that everybody should understand. And I guess lastly, I would just say that don't be afraid to see the process through to its conclusion, whatever it may entail. There will be ups, there will be downs, there will be highs, there will be lows. Some aspects will very, very easily overwhelm you. But know that you are capable, very capable of enduring it. And you'll feel so much better once the process is completed. So just maintain, and stay strong.